My channel. In this video I will discuss idiopathic torsion dystonia. In our OPD a lot of patients with this disease come, so this topic is important if you are a clinician. In idiopathic torsion dystonia there are dystonic movements and postures of the head and neck, especially head and neck. The disease is transmitted either sporadically or in autosomal dominant fashion or in autosomal recessive fashion, or it is transmitted as X-linked recessive fashion. The symptoms begin in childhood or later in the life. If these begin in childhood, these are more severe. If these begin later in the life, these are less severe. Clinical findings. Clinical findings are the patient should be normal at birth and there should be no developmental delay. Furthermore, the CNS examination other than dystonia should be normal and the CT scan is normal in idiopathic torsion dystonia. Dystonic movements of the head and neck may occur as torticollis. That is, torticollis is actually a spasm of the sternocleidomastoid muscle. Blepharospasm, in which there is forceful closure of the eyes. Also, the patient may have facial grimacing and forced opening and closing of the mouth. The disease when starts in childhood, then there is a family history. Also, in this disease there is severe disability of the patient. That is, dystonia leads to severe disability in this type of idiopathic torsion dystonia which starts in childhood. While when it starts in young adults, then family history is unlikely. Mostly it occurs sporadically and it is having less disability. This dystonia, all of these types, persists whole life. Differential diagnosis. If it is due to birth trauma, then it is not idiopathic torsion dystonia and there is a history of birth trauma or anoxia. There is developmental delay. The disease has very early onset and it may occur with seizures, and there may be mental retardation on physical examination or pyramidal deficits on CNS examination. So in this way you can differentially diagnose the patient for idiopathic torsion dystonia. Also, idiopathic torsion dystonia has a DD of dystonia in Wilson's disease or dystonic movements in Huntington chorea, Parkinsonism, and these occur as a sequelae of encephalitis lethargica. Encephalitis lethargica. So torsion dystonia may be seen in Wilson's disease, Huntington disease, Parkinson's disease as a sequelae of encephalitis lethargica. So what is the treatment of this idiopathic torsion dystonia? You should remember that the idiopathic torsion dystonia has poor response to medication therapy, and the medication that is most commonly used is levodopa, and it helps in certain varieties of idiopathic torsion dystonia. Next drugs are, if levodopa fails, then you should try diazepam, baclofen, carbamazepine, then antimuscarinics like procyclidine, and antipsychotics can also be tried. Tetrabenazine can be tried. And if these medical measures are not sufficient, then you can do palliatal deep brain stimulation or you can go for stereotactic thalamotomy. Palliatal deep brain stimulation is preferable to stereotactic thalamotomy. Why? Because in case of stereotactic thalamotomy, there are a lot of chances that there may be a cerebral infection or hemorrhage or broken leads or affective changes in stereotactic thalamotomy. So palliatal deep brain stimulation is comparatively more safe.